Hi everyone, I'm Felicia Kyle,
And I'm Misty Coyle.
and we are occupational therapy students at Utica College, and today we'd like to tell you a little bit about occupational therapy. Occupational therapy is involved in health promotion by working with people throughout all stages of life so that they can live their best life. The importance of health is not to focus on longevity, but to live an overall healthy lifestyle. Occupational therapists help clients in mental and physical health so they can create an environment for the client that is healthy environmentally, socially, physically, mentally, and structurally. It is the overall well being of a client that occupational therapists strive for. Occupational therapists can educate clients who have a disability or health disparity on how to prevent a secondary health condition from developing.
So today I wanted to talk about the benefits of occupational therapy. Specifically, I wanted to talk about lower body dressing and lower body bathing and how adaptive equipment can help people overcome deficits and use the compensatory approach to do this. So there are a few different pieces of adaptive equipment that we have. We have a long-handled shoehorn, we have a long-handled sponge, a reacher, a dressing stick, and a stocking. All of these pieces can help someone perform lower body dressing and lower body bathing. A few different types of clients that we deal with that utilize this equipment are clients that are diagnosed with stroke, MS, Parkinson's disease, patients that have hip fractures, that got total hip replacements, that have hip precautions. All of these people utilize this adaptive equipment to overcome these deficits or adhere to their safety precautions. So the first thing that we're going to go over is the shoehorn, which I'm going to have Felicia demonstrate for you.
Go ahead, get our shoe. You can put the shoe in there, and then help you just slide it on, like so.
And then you can also use it, you can put it in and put it behind your heel to slide your shoe off too. You can kind of put it behind your heel and wedge your foot out to get it off your foot. So that goes both ways. And also we have a long-handled sponge, which I'll Felicia demonstrate for you.
And then this way, you won't have to reach forward or lean forward and risk falling over.
Yes. So this is for clients that have decreased sitting balance and decreased strength in their upper body. The next piece of equipment is a reacher. So there's a handle over here, and then there's the mouth of the reacher. So when you pull the handle of the reacher, it closes the mouth. This is very good for picking up things. So you don't have to reach all the way down and risk falling. You can use this and just reach down and pick things up, or you can use it to pick things up also from above, but for lower body dressing, more than likely you're going to be picking from below. Or also you can use it if you're picking your clothes out of the drawers or a closet to perform the lower body dressing, you can use this also. So it's very handy. So I can show you how to, I'm going to show you how to take your sock off two ways, actually. So you can utilize the reacher by taking off your sock. You have to dig behind the heel. Oh dear. You know what, with my sock, it's probably not the best idea. So let's move on to the dressing stick. We'll go to that one. So this is a better piece, especially if you're longer socks like what I have right now, which is a very long sock. The dressing stick is more ideal. So my sock is a little bit longer and it's up my leg a little bit more. So what you want to do is we have the dressing stick here. This is very ideal for taking socks off. So you have a hook on one side and then you have handles on the other. So you want to take this side with the handles here. You want to dig it back underneath and you want to push behind your heel and you want to get your sock off. That was a lot easier. You can use the reacher to pick it up. But if you have shorter socks on, you can use a reacher to take off your sock. It just varies. My sock was tight and it was longer, so the dressing stick worked better. So I got the sock off with the dressing stick, and then I'm picking it up with the reacher. So I reached down, pulled on the handle of the reacher, and picked up the sock off the ground. Okay. So the next thing I'm going to do is utilize the sock aid to put the sock back on. So we have the front of the sock aid and the back of the sock aid. You can tell the back of the sock aid because there's usually a little round dot back here that indicates the back of it. Okay, that helps keep the sock on. Okay, when you're putting the sock onto it. So what you want to do is you want to put the sock aid between your legs to hold it. Okay, with the front of the sock aid facing you. You want to take your sock in between your hands and put the front of the sock on the front of the sock aid. Make sure it goes all the way on, all the way up to the knots, but not underneath the knots. Okay. You grab the sock aid by both strings, grab it by the handles, you set it on the ground. Notice that I'm not reaching forward at all to do this. You place it on the floor, you put your foot in, and I'm just lifting my leg up higher because I'm sorry, the video can't see it, and you pull. And the sock is on my foot. Okay? And then you just pull it up. So I hope we gave you a little bit more knowledge about occupational therapy and the benefits of it. Thank you for listening to us.
Thank you.